just check my full name and date of birth, please?
Ricky Sharma, 31st of August 91.
Hello, Ricky. So, I've just been asked to do a foot exam with you today. It's going to involve me having a look at your feet, moving them, feeling them, and then asking if you could walk a few paces. Is that okay?
Yep, that's fine.
Okay, thanks, Ricky. So, Ricky's fully exposed with his shoes and socks off, and exposed up to his knees in the shorts. Okay, so looking around the room at the moment, so there's no walking aids or orthotic shoes. If there were any shoes, I'd like to check them for any uneven wearing. Okay, Ricky, would you mind just standing there for me, please? On standing, Ricky seems comfortable. So, inspecting the feet, there's no pes planus or pes cavus, no hallux valgus, and no nail bed deformities of the feet. From behind, there's no varus or valgus deformities of the ankles. Okay, Ricky, would you mind sitting down for me now, please? So, on close inspection of the feet, there's no redness or swelling or deformities of the toes. Just going to have a little feel of your feet now, Ricky. So, there's no tenderness, no of the joints. Let me know if you're in any pain at all when I touch your feet. Okay, that's good. Just going to measure, feel the pulses. Tibialis posterior and dorsalis pedis. Okay, that's good. So I'm just going to ask you to do a few movements now for me, Ricky. Could you point your toes up towards you? And then point them away. Could you turn your feet inwards as if you were clapping your feet? And turn them away? Okay, thank you. And now I'm just going to do those movements myself. Any pain at all? No? Okay, that's good. Would you mind standing up now for me, Ricky? And could you just walk over here? And turn around? And walk back heel to toe for me, please. Okay, that's good. And could you turn around and walk back on your toes for me? And turn around and walk back on your heels. So there's no abnormalities in Ricky's gait there. Okay, Ricky, now would you mind just kneeling on the bed for me? So this is Thomas's test, just feeling the Achilles tendon for any rupture, and then squeezing the gastrocnemius to see if the foot flexes. Okay, that's fine, Ricky. Would you like a hand getting dressed now?
No, that's fine.
Okay, great, thank you. So to finish my exam, I'd like to examine the joint above, the knee, and do a 3-plane X-ray of any joint affected. Thank you.
A good way to remember the structure to any ortho room examination is to follow this general approach. Look, feel, move, both actively and passively, and special tests and functionality. This applies to any ortho room examination for any joint. Tibialis posterior is found behind the medial malleolus. Dorsalis pedis is found in the webbing between the first and second toe, just lateral to the extensor tendon hallucis longus. When assessing passive movement, be sure to stabilize the joint in order to get an accurate idea of range of movement. When performing special tests, place your hand against the sole of the patient's foot. This way, when you squeeze the calf muscle, you should still be able to feel even the slightest plantar flexion. Be sure to assess both feet. Any moving limb in the body is made up of the bones, the ligaments and joints that cushion and hold the bones together, and the tendons and muscles that move the joint. Pathology of the foot can crudely divide into each of these units. Fractures of the ankle or foot usually present with generalized swelling, tenderness, a limited range of movement, and a frank deformity may be seen. The joint itself can be affected by inflammatory arthropathies. Rheumatoid arthritis, psoriatic arthritis, and gout are among the commonest. Psoriatic arthritis will often present with nail bed changes, whereas gout tends to affect the big toe. As part of an inflammatory process or not, feet can become deformed in several ways, such as the medial longitudinal arch, the heels, or the big toe. Damage to the ligaments, in the form of a sprained ankle, often present with pain and a limited range of movement in a particular plane. Damage to the Achilles tendon can happen as part of trauma. Problems with the muscle itself can result from problems with the nervous supply, which generally affect the gait or the vascular supply.